One of the easiest cardiac views and maybe the most visually satisfying cardiac view is the parasternal long axis view. And this, we're looking at the long axis of the heart here, just left of the sternum between the nipple line, and aligning the transducer in the long axis of the heart. What we're seeing here is the right ventricle here, left ventricle here. By convention, the apex is to the left. It would be over here if you could see the apex. But we're looking at really the base of the heart here. The septum, intraventricular septum, is right here, and the posterior wall of the left ventricle is here. The mitral valve is very easily visualized in this view. And here, this is the left atrium, and then the aortic outflow tract is here. And you can see the aortic valve pretty easily opening and closing right there. So you can get a lot of good information from this view. You can see the general size of the left atrium and the left ventricle. You can get an idea of the function of the left ventricle, either by subjectively looking at it, or you can look at the distance between the anterior leaflet of the mitral valve and the septum with every beat. And if the anterior leaflet gets within 7 millimeters of the septum, that's consistent with normal left ventricular function. And you can see in this patient, the anterior leaflet of his mitral valve virtually touches his septum. So that's, you know, that he has good left ventricular function right away when you see that. You can also get a gross look at both the aortic and the mitral valve, and you can look at whether there's dilatation of the proximal aorta here. And it should go right from the valve straight up the aorta without any change in the caliber. The other thing we can see in this view is the descending aorta right here as it goes back past the heart, and you're looking at it in transverse in this view. So you can get an idea how big the aorta is as it descends back past the heart through the diaphragm. You can also see a pericardial effusion. You would see it up here and posterior to the left ventricle here if there was an effusion. Sometimes you can get a left pleural effusion confused with a pericardial effusion. A left pleural effusion would also be back here, but it would go posterior to the descending aorta, not in front of it like a pericardial effusion would. This is a patient in heart failure with a very low left ventricular ejection fraction in the parasternal long axis view. So this is the septum, this is the posterior wall, this is the left ventricle, and you can tell just by subjectively looking at this that left ventricle is not functioning very well. But another way, as we discussed previously, to tell that the left ventricle is not working very well is to take a look at how close the anterior leaflet of the mitral valve here is getting to the septum during when it opens completely. And you can see that there's at least a couple centimeters here. And we mentioned earlier that anything more than 7 millimeters is abnormal. And this isn't even getting anywhere near the septum, so it's a good 2 centimeters. So consistent with when it's more than 13 millimeters of distance between the septum and the anterior leaflet there, that's consistent with an ejection fraction less than 30%. So this patient, by subjectively and by that measurement, would have a obviously very low ejection fraction. The other thing you can do in the parasternal long axis view is you can assess the size of the left atrium and the aortic outflow, or the proximal aorta. And so the left ventricle is over here. The left atrium, you can see here just subjectively, is the internal chamber of the left atrium is actually bigger than the left ventricle, which is very abnormal. And then if you just do a simple measurement from the AP measurement of the left atrium, anything more than 4 centimeters is considered left atrial enlargement, and this is almost 5 centimeters. Similarly, you can measure the aortic outflow, and more than 4 centimeters is abnormal for that. So this is a normal proximal aorta, but a large left atrium. This is another example of a parasternal long axis view and an obvious abnormality. First of all, there's obvious left atrial enlargement. The left atria is bigger than the left ventricle here. And also you'll notice the mitral valve doesn't open very well. So this is a patient who has significant mitral stenosis and left atrial enlargement because of that, and actually presented in heart failure from this problem. And you can kind of get a sense from looking at the left ventricle over here that it's functioning pretty normally. So the heart failure is from the valve problem, not the ventricle.